Breaking news in the field of breast cancer screening. The U.S. Health Panel has released new guidelines recommending earlier and more frequent preventative screenings for women. Let's delve into the details. The U.S. Preventive Services Task Force, USPSTF, is proposing that women should begin preventative mammograms at the age of 40, a decade earlier than the current guidelines. Under the new recommendations, regular screenings would be conducted every other year. This draft proposal by the task force, composed of medical professionals and experts, is now under review. Their research suggests that implementing these guidelines could potentially save the lives of an additional 19% of American women. Breast cancer is the second most common cancer among women in the United States, affecting nearly 13% of women during their lifetimes. According to the Centers for Disease Control and Prevention, the new guidelines are particularly significant for Black women, who face a 40% higher likelihood of dying from breast cancer compared to white women, as stated by the task force. Ensuring Black women start screening at age 40 is an important first step, yet it is not enough to improve the health inequities we face related to breast cancer. These updated guidelines would apply to women with an average risk of breast cancer, as well as those with a family history of the disease or other risk factors such as dense breast tissue, which can make cancer detection more challenging. If adopted, these new recommendations would set the United States apart from countries like the UK and Canada, where screenings typically begin at the age of 50. In the UK, the National Health Service, NHS, considers the cancer risk for women under 50 to be generally very low, and screenings are offered every 3 years. In Canada, screenings are recommended for women aged 50 to 69 every 2 to 3 years. Breast cancer incidence in the U.S. has been on the rise over the past 4 decades, as indicated by a study published in the American Cancer Society Journal. However, thanks to advances in screening and treatment, death rates have fallen since their peak in 1989. Currently, women diagnosed with breast cancer in the U.S. have a 90% survival rate, according to the National Cancer Institute. Our worry is that if the U.S. recommends screening at 40 and every 2 years, it may lead to further disparities between white and Black women in breast cancer diagnosis. The U.S. Preventive Services Task Force guidelines are now open for public comment until June 5th, allowing individuals to provide feedback on these potentially life-saving recommendations. Stay informed as we continue to follow this important development in breast cancer screening guidelines. Remember, early detection can save lives.